pag-discovery natin na mayroon tayong unang kaso ng monkeypox, gumaling na po yung tao, kaya nandito po yung DOH. Explain po namin yung why monkeypox is not like COVID. It's primarily, the DOH should be in a better position to discuss. So, gusto niyo mag-discuss muna yung DOH before you ask your questions? Alright, dali lang po. Doc? Dr. Beverly will be discussing the matter with you.
Thank you, Sec. Yes, ma'am. I'll be reading the DOH statement. The DOH detects the first confirmed case of monkeypox in the Philippines. The Department of Health has detected the first confirmed case of monkeypox in the country. The case is a 31-year-old Filipino national who arrived from abroad last July 19. The case had prior travel to countries with documented monkeypox cases. The case was tested and confirmed positive for monkeypox via reverse transcriptase polymerase chain reaction, or RT-PCR, done at the DOH Research Institute for Tropical Medicine on July 28. The case has been discharged well and is undergoing strict isolation and monitoring at home. DOH has completed its case investigation and identification of close contacts. 10 close contacts were recorded, of which 3 were from the same household. All have been advised to quarantine and are being monitored by the department. The DOH assures everyone that our public health surveillance systems are able to detect and confirm monkeypox cases. Monkeypox is caused by a different microorganism. It's different from COVID-19. Investigation of recent monkeypox cases in other non-endemic countries indicate potential transmission through sexual contact. It spreads mostly by intimate sexual contact with those who have rashes or open lesions. It is not like COVID-19 that spreads mostly through air. While it is now a public health emergency of international concern, everyone can actually help prevent and the spread of monkeypox. We minimize close sexual contact with suspected cases, especially those with rashes or open wounds. Keep our hands clean, wear face masks, cover cough using our elbow, and continue to choose areas with good ventilation or airflow. The DOH also wishes to emphasize that anyone may get it, but if you have travel history to countries with monkeypox and then have symptoms like fever, lymphadenopathy or kulane, and rashes, that's the time that you need to seek medical attention. This will help hasten recovery. For more information, you may access our materials. Please access it through an online folder, bit.ly/monkeypoxfacts, that's one word, with capital M and F. That would be all, Sec.
You have questions? Pia Gutierrez.
Okay, Dr. Beverly Ho po. Ma'am, what is the condition of the 10 close contacts? Are they exhibiting symptoms of monkeypox?
No symptoms for the current close contacts. That's why they're all on quarantine still. They're being observed.
Ma'am, what symptoms were exhibited by the first case of monkeypox? At bakit po ngayon lang po na i-report, ngayon po na naka-recover na itong case natin?
Well, as we have mentioned, the patient was tested and confirmed yesterday, July 28, but we will not be divulging any more of the clinical information because that's all within the purview now of the specialist who's looking at them.
Leigh Alvis, GMA7.
Hi, Doc Bev. Doc, ano po yung gender? May we ask for the gender of the first detected case?
I think we will not go into that, but as long as you know that the patient is a 31-year-old Filipino national.
And ano po yung travel history niya? Saang bansa po siya galing?
All we can say is that the patient traveled to areas with confirmed cases of monkeypox that are typically non-endemic areas.
And dumaan naman po siya, Doc, sa screening when he arrived at the airport.
Yes, dumaan po sa screening, but we all know that the symptoms do not necessarily come out earlier, di ba? Yung iba much later.
Thank you.
Maricel Halili, TV5.
Doc, good morning. Ma'am, just to remind lang po the public, ano po yung SOP with regards po sa monkeypox? Like yung mga yung naging close contact nung case, gaano katagal yung kanilang quarantine? And paano po yung nagiging screening ng mga arriving na Filipinos? Kailangan may symptoms muna before undergoing sa test? Ganun po ba?
Yes, no. So basically, for the close contacts of this case, as with any other cases, based on our guidelines, you need to quarantine for 14 to 21 days, no, based on the onset of your symptoms, no. So we'll just need to observe them for that duration of period kasi doon yung pwedeng lumabas. As to passengers coming from abroad, some of you who might have traveled would note that the Bureau of Quarantine One Health Pass, it also asks screening questions about monkeypox. So that's the first line. Second is fever nga yung isang symptom, di ba? So meron pa rin tayong mga temperature screening na available sa airport natin. Then of course, yung mas hindi lang makikita, no, would be the rashes, 'di ba? Kasi kung naka-long sleeve yung pasahero, no. But efforts are ongoing now para matingnan, no, kung mga naka-jacket, pwede silang papatanggal yung jacket. But then this would be probably the most difficult to screen from afar.
Ma'am, at least maybe know kung saang area po yung case.
All we can let you know now is the case is recovering well at home. I think we wouldn't be divulging any more information other than that.
Thank you, Doc.
Dr. Ho, question from Job Manahan, ABS-CBN Online. How soon can we avail of the smallpox vaccine or vaccines for monkeypox? And sino po ang priority na makakakuha nito if ever?
Well, now our discussions are ongoing. I think we've mentioned it in our previous press conferences that we're working with the US government to secure the vaccines. There's not a lot that's available in the market. Also, that it's only a select population group that will have to be vaccinated. Again, it's not like COVID that all of us need to be vaccinated.
Follow up from Job. Is DOH prepared to contain another global health emergency like monkeypox?
Our systems are in place. But we all need to work together. We need also the public to be vigilant, particularly the key population groups who are at most risk. And based on what we know about monkeypox, lifestyle, no, there is a very clear need to be more careful about who we interact with, particularly sexual, intimate contact. So I think what is clear to us is we're working closely with those population groups so that they will have better preparation, risk perception, that this is a disease that would probably concern them more than the general population.
Any other question for Dr. Ho? Thank you very much, Dr. Ho.